It's great to be here in my new capacity as president of AcuFocus. For years now, many of you have only known me by name or as the brains behind Jim Mazo. Now you'll be able to put a face to all that success. I'm kidding. Of course I'm kidding. That was Yari Mitchell. So let me get started. I'm going to pay for that later. I've got really exciting news about AcuFocus. I want to share with you why our employees are so excited. There's three drivers before I get into this presentation. The first one being the capital raise many of you have probably seen, $66 million, led by KKR with our current investors participating. And the reason that's so important, obviously, is we can now focus on the things that are most important to us, and that's our surgeons and our patients and their outcomes. Secondly, the continued success of the KAMRA inlay rollout in the U.S. As you know, we got approval about a year ago, April. We launched in June, July timeframe. We set out a path where we have a very disciplined launch that would involve a little over 100 sites, and the key was to get the outcomes that we expected, and I'm glad to report we've exceeded on all those accounts, so we're very excited about that. And lastly, as I stand here, we're launching our second product, a CE-marked approved product in Europe, IC8. We're so excited about this because we bring the small aperture technology to the IOL plane in an IOL. And we're going to launch that in some targeted countries in Europe as well as Australia. And again, we're being very disciplined about that launch. If I can move it. There we go. So I've mentioned two products already, but when you think of AcuFocus, I would hope you'd think of it as a technology platform. Small aperture technology platform, and it's a great platform for ophthalmology, and let me tell you why. One, its method of action is passive, right? It's simple physics. It just has to be positioned in the right place, and unless we violate the laws of physics, it works. And anytime you can create a simple, elegant solution for a difficult problem, that's a good thing in the technology marketplace. Secondly, it's long-lasting. Just about every solution you see where you have to create a plus power to accommodate for presbyopia, it's fixing it in a point in time. KAMRA stays, KAMRA lasts, KAMRA is a permanent solution. We hit this hard and often when you come to these conferences. This slide, again, talking about simple and elegant. I think the takeaway here, to make sure everyone in the room understands, is we are not monovision. Because I think that's a misnomer. We are not monovision. When we put KAMRA in the non-dominant eye, we're not trading off distance. We're not giving away distance vision. And it's long, and obviously it's long-lasting. And that's the one thing I'd want you to walk away and understand as it relates to the KAMRA inlay and to our technology. The other thing to understand is we have a lot of strong science, obviously, with 40-plus peer-reviewed papers, over 30,000 patients worldwide, and over 9 years of experience. Now, to be perfectly honest, a lot of that experience is what not to do. So we've learned those lessons. You heard Eric Donenfeld talk about that this morning. We would not be where we're at today without a lot of those hard lessons, and we wouldn't be getting the tremendous outcomes we're getting today without that experience. I'm not going to talk about the market size. I thought John did a great job in explaining the market size, and of course we're playing in presbyopia and cataract, and so this group's well aware of the size of the marketplace we play in. As it relates to small aperture opportunity, KAMRA obviously plays in presbyopia, IC8 in the cataract marketplace. So we're part of 2/3 of that vision correction life cycle. And positioning KAMRA, we're going to be able to handle a lot of the presbyopes that walk in our door. John's and I's technologies are very complementary when you look at our label. The key for our inlay space today is how do we take, and John mentioned this, that potential and realize it. How do we take the potential and realize it? We're going about it in much the same way. We're surrounding the physician with resources. We start with a very experienced sales force, and they're household names for most of you, the folks we've hired. We create business development managers, and we add clinical specialists, because we all believe the key to this is not chasing revenue, it's actually making sure outcomes are what they should be in this early stage of the inlay business, and that's what we're doing. Lastly, we're tremendously excited about IC8 technology. Think about this. Our inlay is really a simple one-piece monofocal lens. The only difference with ours, when you look at it dimensionally, is the fact we have a small aperture placed in the center. A simple, elegant solution for a complex problem. What does it do? It provides a complete range of vision. We're not forsaking distance. It's very reliable. Again, it's simple physics. We haven't seen haze or glare or halo. Neuroadaptation is minimal or non-existent. So you can just imagine it's a lens it's very friendly to misrefraction error. So there's many things that have us excited. Dr. Tarantino and I have brought a lot of technologies to the marketplace in this space, and I don't know that we've been more excited about a lens than this one. Lastly, we're well capitalized for growth. I mentioned KKR, but we have a host of strong partners. We have a very knowledgeable and engaged board led by Bill Link, that all of you know as our chairman. So we're very excited for the future, and as I said, our employees are very excited. Thank you very much.